Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlin, program host for Let's Talk Together. And today our guest is Dr. Alan Meyers, and he's with the Reed Urgent Care and our Emergency Medicine Department. Welcome, Dr. Meyers.
Sharrie, thanks so much for having me. I'm happy to join the conversation today.
And we're excited to have you join us today as we talk about respiratory illnesses. But before we start, tell us how you came to Reed.
Yeah, so I did my medical school at Indiana University in Indianapolis. I did my residency at Indiana University as well, so worked at Methodist, Eskenazi hospitals, as well as Riley Children's Hospitals, where I did all my training. Had never been to Richmond before my entire life. I'm actually from Batesville, which is about an hour south of here, born and raised there. And I don't know, I interviewed at Reed Health and walked around the emergency department and loved the department, loved the people within the organization in the hospital, and since 2020, my wife and kids have lived here. We're raising 3 children here, and we couldn't be more happy to be a part of the community.
Well, we're very excited to have you on our team. Today, as we're talking about it's respiratory illnesses, and as the seasons are starting to change, we're going to talk about both illnesses like colds and flu. What are some of the things that people can do to help prevent these?
Yeah, so really, prevention this time of year is important. And the single greatest thing you can do is wash your hands, right? That's something that we take really seriously, obviously, in a healthcare setting, as we train all of our healthcare workers to make sure they're washing their hands when they're interacting with patients. But that's something that community members can do as well, certainly. The other thing that I would say is try to stay home and avoid others when you're sick, right? Do the things that Grandma used to always tell you to do, right? We joke about that, but stay home, eat chicken soup, watch The Price is Right, I don't know. Just try to isolate yourself from others when you're not feeling well, and focus on taking care of yourself.
And also, as the seasons change, since people are closer to contact, often you see with school starting and being closer contact, and sometimes our children love to pass on germs. So
Sure, I know that firsthand. I have a 4-year-old, a 2-year-old, and an 8-month-old at home, so we get all kinds of exotic diseases at our house, from them coming home. I think
they're sharing with their friends.
They are. Sharing is caring, right? But I think from this time of the year, I don't know, it seems like from now through the winter, my kids just have a chronically runny nose, right? And they get one virus and they clear it and they pick something else up and share it with everybody else.
Right.
So it's just to be expected this time of year. So to some extent, we can't avoid it, right? Being sick is just part of life, right? And I think we have to understand that. But caring for yourself when you're sick and trying to care for your neighbors as well,
yes,
by trying to limit that spread is really important.
And then when you're saying, do what Grandma says, some warm soup and trying to just stay healthy is always a good part.
Absolutely.
And as we're looking into some of those other things, I think we really have caught on about respiratory illnesses, and we know that we're not done with COVID-19.
No.
So we'll probably spend a little more time on what can people do to help avoid getting COVID.
Sure. So I think we're all still scarred a little bit from the 2020 pandemic, right? What a time that was. And I'll tell you, that was, I finished my residency training during the pandemic.
Yes.
And I started my, professional career at Reed during the pandemic, right? So I don't know, I like to think I kind of cut my teeth during the pandemic, right?
Absolutely.
And that certainly is a time that we all would like to have not have happened, right? But we've learned a lot from that.
Absolutely.
Certainly COVID in the year 2024, it just feels a little bit differently than COVID did in 2020. We don't see as many as the really significant difficulty breathing, respiratory symptoms as we did back in 2020. And that's, I think, in part to just the natural progression of the virus and the natural progression of immunity within the community as a whole.
Can you explain some more on the immunity? And often when people receive, as we went through the series of shots, and how that affected as people grew their immunity?
Sure. So we've all been exposed to the virus, right, in many different ways, right, both by getting the virus, right, which I know there's lots of people who have had COVID multiple times, right, since 2020. So just individual immunity by getting the virus, but then also that kind of secondary immunity by getting vaccines, right? And there's varying degrees of immunity within the community as a whole. And when we say the community, we're talking about population, right? And then we get into more population science as it relates to communicable diseases. And the more that people are exposed to a virus, the more that people have gotten vaccinated to the virus, means that there's lots of defense that we all have within our immune system against that virus, right?
I think that was the hardest part that people didn't understand. So what's the shot going to do for me? But it actually protected all of it.
It did, and we know that vaccinations in the case of COVID-19 prevents or helps to prevent the possibility of hospitalization and severe illness, right? You may still get COVID even if you've been vaccinated, right? You may still get COVID again even if you've had COVID previously, right?
Correct.
But it's kind of like you've prepped your body's immune system, and your body recognizes when it's exposed to COVID again. And it already has a little bit of a battle plan, if you will, of how it's going to attack that virus, right, when exposed to it. And that's how immunity works. And we're fortunate that 4 years post that, pandemic time of 2020, that we've kind of built up some defenses against that virus. And it just doesn't play quite like it did back in 2020. But I want to clarify that even though, we're not seeing to the levels of patients with significant breathing issues, ending up on the ventilator, that type of thing like we saw in 2020, COVID is still something that we should respect, right? There are still populations of patients that can get really, really sick from it, right? So even though it's not quite like 2020, we still have to be vigilant about it, right? We still have to protect ourselves.
Think about when it was first announced, I remember, you didn't want to get gas because the gas handles were dirty. This was dirty. We were just really hyper vigilant.
Sure.
And then as we started to learn more about it, then people tended to relax a little bit more. And sometimes not on a good point. So we really, really had to learn.
What a time, right?
The other thing is, what about those populations? We discussed those high-risk populations.
Sure. Yeah, so if you look at CDC guidance on high-risk populations, they really start to note that once you get to the age of 50, your risk of severe COVID goes up, right? Okay. That number significantly goes up once you get to 65, right? And then when we're talking about that 75, 85-year-old population, the risk of severe COVID, again, just continues to creep upward. So, as it relates to high-risk groups, we're talking about age, number one, right? Ages 50 is kind of that soft cutoff, but certainly as you get
and we
older.
have it on our screen. It's just showing. That's probably why we saw so much death, especially like in nursing homes or extended care facilities.
Unfortunately, yes. So the older you are, the higher your risk, right? Other comorbidities, right? Things like underlying lung issues, right? That just sets you back. If you get a respiratory illness and you have respiratory issues, it certainly comes to reason why those patients wouldn't do well. Patients with heart issues, right? Kidney disease, liver disease, immunocompromised states, right? So there's lots of reasons that people could be immunocompromised. It might be because they have some type of a transplant, right? Or they have cancer and they're on chemotherapy.
Right.
Those are high-risk populations that we certainly would recommend even a little bit more care, right? And making sure that they don't get sick as it relates to these respiratory illnesses, or trying to limit their exposure.
And I had a few friends that they they might have had cancer, they might have had something, the comorbidity, and then once they had COVID, there was no fight.
Right. Hits them harder, and those illnesses can last longer, and certainly much higher risk of severe COVID. And when we say severe COVID, we're talking about patients that require hospitalization for COVID, right? It's one thing to get COVID and you're able to stay at home and do the things that grandma told you to do, right?
Right.
And you get better and you don't require us to care for you in the hospital. But unfortunately, with those high-risk populations, they are at risk of having to come in the hospital, right, and get more advanced treatment. And those are those high-risk groups for sure.
And a lot of it, I was learning a lot of, in my naivety, I have respiratory issues. So that was a real big issue on just getting enough oxygen.
Absolutely.
So
Absolutely.
I learned a lot about that.
Sure.
So, and the first time I was like, ooh, it about took me out.
Right.
So, didn't have to, I wasn't hospitalized, but it was a real rough couple weeks.
Absolutely.
So
Absolutely.
then I actually was exposed just like a month or so ago, and just a couple days just kind of down. And so I can definitely see the change in the treatment.
Sure.
But let's go over some of the just a regular upper respiratory infection.
So we see, sorry, go ahead.
No, just if you can.
Yeah, so we see a lot of that going on, and I actually can speak with experience. A few weeks ago, we had that going around my house, right? Kids were coughing and sneezing and had low-grade fevers, and I was coughing and sneezing and had a low-grade fever. Generally, your typical upper respiratory infection is almost always starts as a viral infection, right?
Okay.
And there are hundreds, if not thousands, of viral variations that can cause these things, right? And I can get really nerdy and start naming some of these viruses, right? But certainly, generally the upper respiratory infection causes the runny nose, the nasal congestion. Because of what we call postnasal drip, you'll get a cough associated with it. You may get a viral bronchitis too, which is where the virus is actually attacking some of the lung tissue. The thing that actually gets most concerning, though, and what we've seen a lot in the emergency department and in the urgent care, are patients that start with these viral illnesses, right? And they have a cough, runny nose, that type of thing for a week or so, and then they get dramatically worse. And they develop a worsened fever, worsened shortness of breath, worsened cough. And it's because that viral infection actually turned into a bacterial infection.
Okay.
So when I'm talking to patients about this, I sort of liken it to, you can imagine that your body's immune system is kind of a brick wall, right? And when a virus comes in, the virus kind of starts to punch holes in that brick wall, right? Doesn't completely knock it down, but it definitely weakens that brick wall, right? And it allows for bacteria to kind of sneak in through the holes, right? Or sneak in around the wall. And when that happens, you can actually get a bacterial superinfection, and you get that pneumonia in your lungs. So the lung tissue is weakened by the virus, and then the bacteria comes in and you actually get a big focal pneumonia, which requires antibiotics. So it's one of those things that if you develop a cold, and after a week or two, you're not getting better, more fever, more cough, you really need to seek care, because there's a high likelihood that you could have a pneumonia associated with that as well.
And so if you've been up and down the aisles at your local pharmacy, and you probably need to take a next step.
You probably need to take a next step and let the professionals handle it at that point, and let us see you then.
Maybe grandma's recipe is just not going to work.
Sometimes grandma doesn't get it all the way right?
Right.
And sometimes you need some help from us, and we're always happy to see you in the urgent care in the emergency department.
From there, and with that entire infection, that's when you're getting with the fever and the body aches and the earaches. So.
Absolutely, yeah, and again, those would be all of those kind of viral symptoms that may lead to something more sinister.
Okay. The other things with when it goes from like just with influenza, just overall influenza, can you share with some of the with the high risk groups and then how it affects different groups?
So influenza is very similar to COVID in the kind of high-risk groups that it can affect, right?
Okay.
So again, the elderly is always an age group that we worry about. Underlying comorbidities, kidney disease, liver disease, heart disease, lung disease, right? Immunocompromised state. those are the groups that really can do poorly with the flu. But the converse, or I guess the other side of the spectrum, babies also are really affected with influenza, and we really worry about that population specifically with influenza. And we're talking like neonate young babies, right, within the first few months of life. We really want to try to keep them away from the flu. And as we're speaking about babies, I know we'll get to RSV, I think, here in a little bit, but it's really important, especially this time of year, to try to stay out of the faces of babies, right? And we all love a baby, right? I've got one of my own at home, and especially, that new niece or nephew or that new, granddaughter, grandson. We all want to snuggle those babies and love on those babies, especially those first few months of life. This time of year more than ever, though, it's really, really important that if you're sick, stay away from the babies, right? If you're holding a baby, make sure that you're washing your hands before you do that. And then finally, really try to stay away from their face. So no kisses on the face, no breathing or blowing on the baby, just trying to stay out of their nose and mouth, just because we want to try to keep them from kicking around things like RSV or the flu, because in that age group it can be really, really dangerous.
And when you were saying that, I just recently, just even over this past weekend, I've learned just generationally, it's been interesting with friends and how their children are raising their kids. It's no one's going to hold the baby this way. Don't kiss the baby. Don't do this. And then some of the older people were, no, I've done this. I raised them this way. But because they've learned more from technology, some of the safety precautions that they were using are things that you were discussing.
Absolutely.
It's like you shouldn't kiss the baby.
Right. Right.
Did you wash your hands? Did you do whatever? So
absolutely,
and that was really interesting for me.
For sure, and people don't always think about this, right? As an emergency physician, we see from time to time febrile, what we call the febrile neonate, right? So that is the baby.
And what is that? What does that mean?
Yeah, so that is the baby less than 28 days old that has a fever.
Okay.
And that's scary because certainly babies of that age can get a viral infection just like we can. But the other thing that you worry about in babies of that age is because their immune system is so underdeveloped and so weakened, they're virtually immunocompromised. So they are at high risk of picking up really significant bacterial infections. So when a baby that's less than 21 days old, less than 28 days old comes into the emergency department with a fever, that's a huge workup. And they get blood cultures and a spinal tap and all of these things because we have to rule out that they don't have meningitis or they don't have a really significant infection. Sometimes it's just a viral infection that they have, but you can't be sure without doing the big workup. So, I always caution new patients, new parents of keep your baby safe, keep your baby from having a fever so they don't have to undergo that big workup in the emergency department, right? Because nobody wants to see their baby with all those tests.
It's stress on the baby, it's stress on the parents.
Exactly.
And everyone's pretty
But the stakes are just
out.
too high. If they had a bad infection, we want to catch it early.
Yeah. The what are some of the symptoms just with regular influenza, like with fever and just like a sore throat or some of those things?
Yeah, so the typical flu, influenza, generally presents with fever, body aches. Those are the big ones, right? People describe just feeling horrible, right? Almost, I got hit by a truck, right? And they just really feel badly. Again, you can develop the cough, right? Headaches are very common, both in COVID and in influenza. So those are the big flu symptoms, right? But again, as the flu can transition into more respiratory illnesses, right? So you can develop the cough and the shortness of breath with that afterwards.
And especially since COVID, what about the more of the long-term? I've seen people that have like a COVID cough or they've had it, and it might be months, but they still have a cough.
Yeah, cough is annoying. Cough is one of those things that we see frequently in the emergency department, and I'll tell you, there's just not a good treatment for cough. A lot of over-the-counter cough medicines, they're just not all that helpful, right? And they do have a lot of side effects that with them, so they're, not always the best. But you can have, after a bout of COVID, right, or a bout of pneumonia, you can have a cough that lingers for weeks with an S, right? I tell my patients it all the time, weeks with an S. And know that, it's annoying for you. Obviously, it's annoying for your family that have to listen to you cough. But there's not a great treatment for it. So yeah, that is definitely a kind of a more long-term side effect.
And since with COVID, and if I've noticed now, like if you're somewhere and you cough, the entire room turns around to look at you. So
I know we're so hyper vigilant now as a society, right? But with good reason, right?
Right.
We've been through a lot over the past.
I was
4
waiting
years.
on you to give me a magic wand about the cough.
As soon as I find one, Sharrie, I will let you know. But I do not have a magic wand for the cough.
Okay.
Yeah.
The another thing is, what about vaccinations? And then we had some people that were really good with vaccinations, and then some that haven't, and now they're behind on their different vaccinations, even with flu or COVID.
Mm-hmm.
What would you recommend?
Yeah, again, still recommend vaccinations for both influenza and COVID-19, right? Again, particularly if you are in that high-risk category, right? It should just absolutely be what you do on a yearly basis, and update your vaccines and do what you can to protect yourself, right? We've now had, 4 years of science on the COVID-19 vaccinations, right? Obviously, much longer on the influenza vaccinations.
Right.
Both are safe. Both certainly seem to be effective. And I would recommend it. There have been changes by the FDA as far as age groups that are able to be vaccinated, right, as it relates to COVID. There's lots of difference based off of the vaccination, so we won't go into all the details on that, but certainly would recommend those as we get closer and closer to this, viral season.
Right. And also with the, I know I'm scheduled like in the next week or so for my flu shots. Mm-hmm. So I know that some people didn't get a flu shot. Well, I got a COVID shot, so I didn't need that.
Yep.
So.
2 different viruses, right? 2 different ways that they affect your body, 2 different shots, right?
Okay.
So one does not protect against the other, so would definitely recommend update your yearly flu shot, right? Get your yearly COVID shot, and certainly vaccinate yourself against these things. Doesn't mean that you won't get sick. Right? And again, clarify, it does not mean that you won't get sick. However, vaccines give your body sort of a jump start, right? And allows you to mount an immune response against those viruses when you come in contact with them.
Another respiratory condition is RSV. Mm-hmm. Can you talk about RSV?
So I actually work as our pediatric champion in the emergency department. So obviously I take care of adults and kids as well. Kids is sort of my area of interest in emergency medicine, mainly because I have 3 of my own pediatric patients at home. But RSV is something that we worry about this time of year as well. And RSV causes really a syndrome that we call bronchiolitis, or a disease process called bronchiolitis. And when babies or young kids get RSV, generally they're presenting with this bronchiolitis picture. And what bronchiolitis is it's essentially the airways of these kids or these babies really get filled with like mucus and sloughing lung tissue that causes a really significant cough, right? And can cause really significant shortness of breath as well. You'll see these babies come in really working hard to breathe, breathing very fast. You'll see their little bellies kind of sucking in and out, right? Or their nose flaring as they're trying to get air. Unfortunately, the treatment for RSV is you just have to support the kids through it, right? So if they need supplemental oxygen, we give them supplemental oxygen, right? Unfortunately, in really severe cases, sometimes those kids do require intubation and to be put on a ventilator to kind of let their lungs heal. That's rare, but it certainly can happen. But overall, the body just has to fight that infection. There's not an antibiotic for it. There's nothing that we can really give that speeds up that process other than just your body naturally healing. Right. But the important thing to know is, RSV gets a lot of a lot of press, right?
Yes.
A lot of
And
parents.
then lately I've seen it more, traditionally I've always heard it with babies, but now with other people. And
So
older.
Sure. So you can see this bronchiolitis picture generally happens with infants and toddlers, right? Get bronchiolitis, and that's the sort of symptoms that we were talking about. But adults kick around or RSV as well,
Okay.
right? If you get RSV, it's going to present like an upper respiratory infection, right?
Gotcha.
Runny nose, sore throat, cough, that type of thing. But then you can spread it to the baby, which is important when you're holding the baby. Don't cough in the baby's face. Don't be kissing the baby. But we do see a high uptick in RSV this time of the year. So again, it's really, really important that we're practicing all of those kind of infection prevention things that we had talked about: hand washing, protecting your cough.
And as we're wrapping up, can you give us some tips just deciding where to go to get treatment for these illnesses? Whether it's the ED, urgent care, or their primary care physician, we have Read Ready Care.
Sure.
Tell me about it.
So it's like the many faces of Meyers, because you might see me in the urgent care, you might see me in the emergency department. I kind of do both. So I'm happy to see you wherever you come to see me. I guess I'll start with the emergency department. Those are severe patients that if you feel like you're having a life-threatening emergency, we want to see you in the emergency department, right? And if you are at all concerned about that, do not pass go. Come to the
straight.
ER, right? If you're worried, I'm worried. Generally, that would be things like having significant shortness of breath, right? Chest pain, certainly, uncontrolled vomiting, right? Fevers that you can't get under control and you're just not able to eat or drink because of that, right? Those are, kind of think of the really severe cases, that's the emergency department, okay? Urgent care is going to be more of that lingering cough that we talked about, right? A few days of cough, but you're able to keep down liquids. We're not worried that you're dehydrated, right? That type of thing. Certainly the runny nose, the sore throat, when you're worried that your child may have strep, right? Or a budding pneumonia. Certainly we're happy to see you in the urgent care. And we do have lots of capabilities in the urgent care, right? We're able to get chest x-rays. We can get those types of basic images. And then certainly if you feel like it's something that can wait a few days, you want to kind of see how things go, and if you're getting better, and you can call your doctor's office and they can get you an appointment in a few days, and you want to kind of see how things go, I think certainly a clinic is fine, right? Call your primary care, and they can get you in over the next few days. But do know, and I want to make sure that the community knows, that we are ready to care for you in the urgent care or in the emergency department when you need us, right? And that's a responsibility that we take really seriously, and we want you to know that you're going to receive good care at either spot. If you're worried, we're happy to see you.
Okay, and on that note, we want to thank you, Dr. Meyers, for joining us today on Let's Talk Together.
Thank you so much.
Thank you. And thank you for joining us today.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.